You've probably heard about laser cataract surgery and wondered, is it better? Is it for me? Let's talk about what the laser really does. Both laser and standard cataract surgery are routinely performed and considered very safe and effective. The femtosecond laser can make incisions, perform lens fragmentation, make the circular opening on the lens capsule, and make incisions on the surface of the eye that eliminate astigmatism. The laser carries extra fees. It uses 3D imaging to optimize the procedure. Laser is great for patients who get toric and trifocal premium lenses to improve their centration or position within the eye, which improves clarity of the vision postoperatively. The surgeon still does most of the work. The laser just adds precision. I don't just sit in the corner drinking coffee while the laser operates. I run the machine and the device. The laser has several advantages that I feel make a big difference in my patients. The first is the perfect circular opening in the lens capsule every single time. Instead of the surgeon scratching the capsule with a needle and peeling a circular opening called the capsulorhexis, the circle will be made by light and will be perfect. This is important so that when the lens goes in the eye, the tension in all directions is equal, and this helps the lens stay perfectly centered. This is important for trifocal and toric lenses. The second advantage is, instead of the lens being broken up by this vibrating needle tip that jackhammers the lens 10,000 times a second, laser light breaks the lens into smaller and easier to remove pieces. By using less energy, the surgery is less traumatic to the cornea and other tissues in the eye, in my experience. The last advantage of laser cataract surgery is those reshaping incisions in the cornea that can reduce or eliminate astigmatism. This too can give the patient much better clarity without glasses. In patients with extreme astigmatism, I can combine laser with toric to reduce their astigmatism as well, and this has been pretty exciting for my patients. Just like standard cataract surgery, laser cataract surgery requires a great deal of experience and many cases to become proficient. Many surgeons that are great at traditional cataract surgery may have never used the laser before, or maybe they used it for a few cases and abandoned it because frankly the learning curve for performing laser cataract is very steep. I personally have done tens of thousands of cataract surgeries, and currently, more than 60% of my cases are done with the laser. Before I started using the femto laser to perform cataract surgery, I had done about 12,000 cataracts. This was about 10 years ago. I was very confident in my surgical skills, and I was pretty sure that laser couldn't offer my patients any additional advantage. I didn't see how it could help, since I was already doing such good surgery without it. Then I observed a few high-volume laser cataract surgeons, and I was pretty amazed to see the benefit that femto laser adds. There are many eyes where the cataract is very advanced or the lens is quite dense. Maybe the pupil doesn't dilate well. The front of the eye is very shallow or very deep, or the tissues in the eye are particularly weak before surgery, such as cases with a previous trauma or a condition called pseudoexfoliation. In these cases, I find the cataract much easier to remove safely with the laser. If the cost of the procedure was the same, I would only perform femto laser cataract surgery. However, the cost is not the same for laser. Medicare and all private insurances will not pay for the upcharge to use the laser. They will, however, pay for all the other parts of surgery and allow you to pay the upcharge. The patient has the option to use the laser at the time of surgery or go with standard surgery. I want every one of my patients to at least know that this technology is available and what advantages it may have for you. We will educate you on these options at the time of your consult, and you can proceed however you like. In summary, both techniques give excellent outcomes. The laser option can enhance precision and improve safety for the right patients, especially those choosing premium lenses and those with astigmatism, dense cataracts, higher risk cataracts. I can recall many hundreds of cases where I started the surgery and had no idea what I might encounter, and I remember feeling very happy that the patient chose laser when I got into that case. In our final episode, we'll cover cataract surgery for patients with glaucoma and how we can help protect your long-term vision.